Hello and thank you for joining us today. I'm Paul Stover, President of the OC Forum, a nonprofit, nonpartisan organization dedicated to providing a civil public space focused on events that impact our community. Our goal is to facilitate extraordinary programs with visionaries, connections, conversations, and solutions. On behalf of the entire OC Forum Board, we'd like to thank you for joining us for the Future of virtual program series made possible by presenting sponsors UCI and UCI Health. With the support of all our generous sponsors and viewers like you, the OC Forum has been able to provide great virtual conversations with completely open access to the entire community. If you are able, we would appreciate your donation or membership so that we may continue to provide these timely programs. We look forward to your continued partnership as we celebrate the OC Forum's 30th anniversary throughout the year. Because without your support, our public service programming simply would not be possible. Thank you again for tuning in, and we hope you enjoy today's program. And don't forget to have a great OC Day.
At UCI, we believe in the infinitely curious. We believe in the courageous of thought, the ones willing to fail again and again until one day they don't. When you have the courage to see things differently, to see opportunity where others see impossibility, amazing things will happen. At UCI, we stop at nothing to change the world, to save lives and deliver the extraordinary.
Good afternoon, everyone, and thank you for tuning in to another fabulous OC Forum event, a critical program, The Future of the COVID Curve, presented by UCI and UCI Health. I'm Lucy Dunn. I'm President and CEO of the Orange County Business Council. I'm thrilled to be your moderator today. The Business Council has been working for 25 years. Actually, this year is our silver anniversary. And we firmly believe that good health is good business. And therefore, this panel is really critical to advancing both of those wonderful philosophies. You're all aware, of course, that COVID-19, or the coronavirus, has continued to impact our Orange County community. And as we stand here today, Orange County is facing a serious surge of new COVID-19 cases, along with the corresponding hospitalizations and ICU patients, higher than at any point in this pandemic. To put our situation into perspective, when the OC Forum presented its previous program on COVID-19, Orange County had a total of 12 positive cases. Today, we have more than 21,000. On July 1st alone, Orange County reported more than 1,800 new cases in a single day. So there's really no better sense, no better way to get a whole idea of what's truly happening here in Orange County than hearing directly from those experts on the front lines of saving our lives and our economy. So our panels today of both healthcare and business, we would begin with our healthcare professionals on the front lines. We have with us today Dr. Susan Huang, Medical Director of Epidemiology and Infection Prevention prevention. I was having trouble with epidemiology, and now I can't do prevention. Epidemiology and infection prevention at UCI Health. Dr. John Hyatt, Clinical Director at KPC Health, and Dr. Adam Solomon, Chief Medical Officer at Memorial Care Medical Foundation. And last, joining us, Dr. Jasjeet Singh, Assistant Director of Infectious Disease at CHOC, who will be joining us virtually in just a moment. So let me start with you, Dr. Huang, if I may. There's so much contradictory information circulating out there regarding the spike of cases here in Orange County. There's thought that there are waves of this disease. Are we in the first wave? Are we in the second wave? Can you do a little clarification of this and why there are this surge of cases in Orange County?
So historically, viral pandemics tend to have waves, largely linked to the reopening of schools or the drop of the temperature in the fall. This was true for the 1918 pandemic, true for many measles outbreaks, chickenpox outbreaks. And here in Orange County, we shut down before we actually surged, and that shutdown gave us vital time to be able to prepare our supplies and our testing capabilities and our protocols. And then the days got longer, the weather got nicer, and we reopened, and all of that creates interactions. And we're really seeing the numbers climb because of those interactions and because of the differential behavior that people exhibit when they're asked to do things that they haven't had to do before. And so I think that what we're seeing now is we are in the first wave. If we can contain it before the school year and the temperature falls, then we will have a second wave. And if we don't, we will have a compounded wave, which would be really devastating for Orange County.
So we are in the first wave now. We have not gotten out of that. We haven't even started the second wave.
Right.
Very good, very good. Good clarification. Dr. Solomon and Hyatt, can you each tell us what's happening in each of your hospitals? Give us a glimpse of what's happening.
So Memorial Care Health System, as you're well aware, is a 4-hospital, nonprofit integrated health system with 2 of our hospitals in Orange County. And we had some experience before with the other pandemics or the other infections that started to spread, such as Ebola and Zika, and set up a command center that had physicians, administrators, operations people to prepare us to address any issues that came along in real time. And we started off with a priority list of what are the things that we're going to make sure that we monitor and maintain. And the very first item on that list was safety of our staff and physicians to make sure that they could care for our patients safely. And making sure that we have adequate protective equipment for them as well. Part of that was setting up a zone system. So if a patient comes to the emergency department, they are going to be screened, and depending on their issue and their screening history, they'll be brought to an area that we know is low risk, or in an area that has enhanced protective precautions for them as well as processes for the staff. And we've also started bringing back our elective cases that shouldn't be delayed too long. So some things aren't necessarily emergent. And during this initial portion, when we stopped doing all elective procedures, there were some people that weren't getting urgent health care needs that had to be taken care of. Now we're able to start taking care of those, screening them ahead of time to make sure that they're not going to risk exposure for others. We've started to see just in the last couple of weeks a significant uptick in the number of cases, people coming to our urgent cares, our primary care sites, as well as our emergency departments with symptoms and histories of exposures or no known histories of exposures. And the testing rate of positivity has also increased.
So Dr. Solomon, you do have capacity now for both elective surgeries in addition to caring for your COVID patients.
Correct. So we're monitoring this every single day for all of our facilities to make sure that we are able to safely take care of patients, and also looking at what is prioritized, what really needs to be addressed and taken care of now and shouldn't be delayed versus things that could be delayed further, as well as the spacing and timing of how patients are getting cared for to make sure that we can do social distancing and keep everyone safe and secure.
Very good. Thank you. Dr. Hyatt. What is happening with KPC?
So KPC Health has 7 Southern California hospitals. We have So we're experiencing different realities at different times. That we saw our first wave early on in our Riverside hospitals, particularly Hemet Global Medical Center and Victorville Hospital. And through that, we were actually able to get ahead of what was coming for Orange County. Now, we have 4 hospitals in Orange County, and we had a slight tapering back of cases in Riverside and San Bernardino just when we've seen an uptick in cases here in Orange County. Now, this week, we're actually seeing an uptick there as well. So as we look at the numbers, besides Orange County, we're seeing them grow in Riverside and to a lesser extent in San Bernardino. I think Dr. Wong and Dr. Solomon said some very important things, that what we had done as a county was to, and as a state, was to prepare so that we weren't overwhelmed with cases. That it wasn't that we were going to have an absolute decrease in cases, but we were flattening the curve to be able to get in front of this. And I think all health systems have done an excellent job doing that. Dr. Solomon also made some very important points that every day, we're on a level 2 right now, which means we have multiple calls to direct how we're managing all the different things in our hospital, our protective equipment, how many surgeries we're having, what surgeries we're prioritizing, how we're prioritizing tests that are available, which has certainly been challenging as the numbers come up. And I think the most important thing here is that all of us, even the systems not represented, the hospitals are safe, and we need to keep moving ahead. We have patients that are infected with with the coronavirus. We have them in isolated floors, rooms. We have ICUs sheltered. The staff are well versed in how to care for patients, and we're continuing to take care of the pandemic as well as business as usual.
Very good. That's terrific. So you at KPC still have capacity for both elective surgeries in addition to our COVID patients?
Yes. Every day, multiple times a week, we are looking at what our nursing staffing is, how the physicians are doing, what is our bed capacity, what's our ICU capacity, what's our ventilator capacity, and what surgeries we believe, projecting out for a week or two, are safe to do. We're mostly doing outpatient surgeries.
Very good. Well, that's good to know, and that it's real time. So just because we say this today, you have to assess, every one of you has to assess every day as the numbers come in, as the patients come in, correct? Here's a question for all of you. Are healthcare systems in Orange County responding to this surge in our cases? You're responding both individually, but you're also together. Is that correct? Are there new partnerships that you see? Are there new ways of doing business in healthcare for Orange County that you may not have anticipated? Dr. Huang, you want to jump up?
We probably see, this is a time when we all really band together. This is a contagious disease. It's population health. We have strengthened both of our collaborative ties that already exist as well as made new ones. For example, Joe Brothman at UCI, he leads the emergency preparedness team for the Orange County Hospital Coalition, and they have stepped up the number of times that they meet in order to address the deep need here in Orange County. Similarly, for infection prevention, we have stepped up the frequency of our regional calls for infectious diseases, infection prevention, as well as across the UC system for academic medical centers. And I think we've all forged actually a really nice community coalition that includes all of the groups here, including CHOC on the phone, the Memorial Care System, Hoag St. Joseph's, UCI, really looking to get words out about healthcare and how to keep us safe in this pandemic. A lot of Instagram efforts ongoing in order to try to reach the younger group to keep them safe until a vaccine is available.
Dr. Hyatt, you mentioned your work in Riverside, San Bernardino counties as well. Are you partnering with those providers to see what's happening there? Any lessons being learned from watching what other counties are doing?
Yeah, I think I would like to echo what Dr. Wong said, that we probably are having an unprecedented cooperation between healthcare systems, that we are speaking to the heads or the CMOs of multiple systems multiple times a week. We know the amount of patients that have a COVID infection that are in the other San Bernardino hospitals. We are looking at the Riverside capacity, and we really know what's happening at Memorial Care and UCI and Hoag and Fountain Valley and all the other hospitals here.
It's very good. Dr. Solomon, I'll put you on the spot a little bit. Feel free to jump in on that last question about partnerships, but also in learning from each other, are we learning new ways of treatment that we didn't know at the beginning of this pandemic as well? Could you address a little bit about that?
Sure, and the other thing is not just locally, but also that sharing of information nationally has been essential. Towards the beginning, we're part of the Leadership Alliance, part of the Institute for Healthcare Improvement, and we were able to learn from our colleagues in Washington State and in New York who dealt with the surge far before we did. So as we started to prepare, we had the information from their experience that we could put in place, which set us well ahead in advance for that preparatory work that we wouldn't have had otherwise. And that kind of communication continues to this day. You can put out a question and get a response from other states. What are you doing? How are you dealing with this right now? And that's been very, very helpful. And we've also been able to collaborate with the business community. Some of that has been the business community supporting us with equipment that we needed at the beginning. But also us educating the business community in how to prepare and deal with this pandemic, what to do about their employees who may get sick or were sick and want to return to work, that kind of thing.
Very good. And any lessons learned from the beginning of COVID-19 on treatment and where we have gone today? Lessons learned in reducing the number of deaths. For example, I understand, so correct me, that maybe we may have put our ventilators into operation sooner than what we're doing now when we have things like remdesivir and putting folks on their stomachs. So can you talk, any of you address that one in lessons learned on treatment and protocols?
Yeah, so we used our experience and our colleagues in other states on what their experience had been at the beginning. If you remember, there was talk of the value of remdesivir, of the value of hydroxychloroquine, whether or not steroids improved or worsened conditions. It was very clear that having patients in that prone position was significantly beneficial for patients. There was understanding that putting patients on what's called a BiPAP machine or a CPAP machine, something that sometimes will help somebody with some, for example, emphysema breathe, wasn't necessarily as beneficial for patients with this novel coronavirus. But we were also able to enroll in certain studies. So for example, we are currently participating in a trial through Mayo Clinic on convalescent plasma that has shown some benefit. The details on remdesivir, we are also a remdesivir trial site, and so being able to have that available has shown some benefit for specific patients as well.
Very good, very good. So it is interesting. It is a new disease, and every one of us, we're learning every day, both from the healthcare perspective in addition to the business perspective. Can any of you jump in on this one? We've talked about capacity. How much capacity to manage patients for COVID-19 do our hospitals have? Dr. Wang?
So currently we have 35% open capacity for our ICU care in the county. We're watching that very carefully. It's one of the metrics that is pretty critical, is how many people are hospitalized, how many people are in intensive care units. And when that dips down into the teens, that becomes a real signal for concern. So watching our capacity, making sure that it's robust. We all have surge plans. We've been planning for pandemics for years. We have expansive capacity to to take in ventilated patients if we need to, and we have sought and received approval from the state to actually use areas that were not previously used for either ventilated patients or for patients at all, to be able to expand both ambulatory, inpatient, and intensive care unit capacity if we need it.
Very good.
But I should say it's not unlimited,
Exactly.
and I think we really do have to be attentive to the trends that are happening here in Orange County.
Very good.
Yeah,
Hyatt?
I would say that across our system, it changes daily, but we're running 30 to 40% capacity, both in ICUs and available beds for patients that are infected with COVID or for other patients. And I think one thing that has been very positive is that some of the regulations we're under have been, I won't say loosened, but we've actually moved to much more of a common sense approach of how to use a hospital, how to maximize what we can do in our hospitals. So that as it was said, we're using spaces in the hospital that normally we wouldn't have, but are perfectly safe and appropriate to take care of patients.
Oh, very good. And Dr. Solomon, do you agree that the teens we should be nervous about, but your capacity?
So our capacity, as I said, we're monitoring that on a daily basis and doing well. It's been interesting to see this shift in the population that has been coming in recently. And one of the things I just wanted to mention is we use this word surge, which makes it sound like all of a sudden we get overwhelmed by this volume of people coming in, when in fact what happens is because these patients, their respiratory system starts to decompensate, they end up staying in the hospital longer. And so on the one hand, yes, there are more people coming in, but it's not this dramatic sudden rise in the patients that are coming into the hospital. It's that patients leaving the hospital slow down. And so we saw that especially in New York, where you had these patients that were in the ICU on a ventilator for weeks, when normally a patient would be in a ventilator in the hospital for a few days. And then once the patients, if they were improved and they're ready to leave, to be able to get them out of the hospital safely to an environment that's willing to accept them and able to take care of them, that sometimes would have caused delays. We're working on that, and that's improving as well. Mm-hmm. So I just feel that people sometimes take the word surge and expect this sudden, all of a sudden this outpouring of people coming in, when it is that slowed discharge from the hospital.
Very good. Do you all agree surge is probably not the right word to be using here?
I think that it has a number of connotations to it. We do see rises. They do tend to be more gradual. And I think that the incubation period of 14 days means that anything that we've done in the past 2 weeks, we're still reaping the consequences of. And so it's a rolling amount, but I can say that the trends are pretty clear, that week to week, month to month, we are clearly rising, and if that is equated as a wave or a surge, I think that's still a fair description.
Very good, very good. Next question. The County of Orange recently released increasing detailed information about cases and testing figures. They have a new dashboard. It's kind of confusing to the public. What do you think about their dashboard? What is the data telling us at the county? Are there things that you would have liked to see different? And can you counsel our audience as to the things that you look at that perhaps they should also look at? Can we start with you?
Sure.
Thanks, Dr. Hyatt.
So I think one of the issues we have is in trying to, and this is not the county, this is in general, we're trying to get usable information out. And in that, certainly there's no perfect amount of information. And I think it's going to take a retrospective look in 6 months or a year for us to really say we completely understand what happened. Mm-hmm. Short of that, there are some things that are pertinent. Now, I think, not to get embroiled into lots of controversy, the more tests you do, the more likely you're going to find more cases. So that's true. But those cases are happening whether we test for them or not.
Yes.
We do know that. And we know that there's also a large asymptomatic population. So no matter what's put out there, but I think important things for the public are how many people are in the hospital. How many people are in the ICU? I think they're important things that we can look at so you can understand. And then I believe really anything we can convey out there that is helpful. But any data you put out there is always going to be controversial or interpreted differently. And sometimes I think we get ourselves locked in the quagmire of debating the data, not what's actually happening.
Yes, I think that's a good point. Dr.
A
Huang.
few things that I find helpful because of the testing variation is to look at the number of hospitalized people. When they are severe enough to come to the hospital, that's an absolute number. There's about 700 right now in Orange County. I also look at the ICU care, and they aren't faking that. They have a need. They come to attention. There's about 250 people in Orange County that are fighting for their lives with COVID-19. And those numbers, along with the residual capacity, are we coming down? Are we going to get ourselves into trouble if we don't stem the tide? Are pretty important ones to watch. The other things that I watch is to look at the zip codes that are affected. We were seeing a large amount of exponential growth in the case numbers in the high density areas of Orange County, and now it is uniform across Orange County. All zip codes up. Cases are rising, so that's not a good sign. If you look at the age distribution, we're seeing younger individuals coming to attention. So all of those things are important, and we know that whatever numbers are posted, we have exceeded our test capacity. UCI is clocking about 1,200 tests a day right now. We will be at over 2,000 next week. We will be at 3,000 a day in August, and we are not meeting the need. We desperately need the County Department of Public Health and all areas to really step up and increase the testing capacity so that we don't have people out there who don't have a diagnosis and are moving about and not staying home when they're ill. So that's going to be critical. So what we're seeing right now is the tip of the iceberg. The counts are absolutely underestimated.
Very good, thank you. We are at the witching hour of closing this panel, but Dr. Solomon, I want to give you the last word. What is the most effective preventative measure that we should be asking our audience to pay attention to?
So this virus is spread through droplets. There's some discussion of whether or not it can be aerosolized as well, but it gets spread from person to person, and that can occur even if the person themselves that's infected doesn't know that they're infected. They may not have developed symptoms yet, or their symptoms may be so mild that they don't feel sick. So the idea of everyone wearing masks, they call that universal source control, is to help prevent the spread of this virus. So for a person to wear the mask, it is not for their own protection necessarily, it is to protect others around you. And that same part is that social distancing. The mask is not going to prevent that spread completely, so having people further apart decreases the amount of virus that could get from one person to another because it's time dependent and distance dependent as well.
Excellent, thank you very much. Masks, physical distancing, two things, don't forget them. All right, doctors, I can't thank you enough for this great discussion. We knew this half hour would go very, very fast, but I think we packed it with some great information. Thank you for your leadership and your insights. And so now, joining us virtually is Dr. Jasjeet Singh from Chalk Children's Hospital. Doctor, thank you for being here. Please tell us, what are you?
Well, thank you for having me here today. I am going to try to address the pediatric specific issues of this pandemic for you today. And as we say in pediatric land, children are not just small adults, and they have vulnerabilities and considerations that are unique to their age groups. And so that's what I'd like to give you a little bit of an overview on. So if I can have the first slide. Should I start again? Okay. All righty. Pick up where I left off then. Okay. If I can have the first slide. Okay. Oh, alrighty. I can't see it. That's fine. You know, from the information that we have available, it does seem that children get infected less frequently and less severely than older age groups. But I really do want to emphasize that they do get infected. And when we have widespread community transmission, as you've been hearing about, we will see more of our children getting infected, particularly our high-risk children getting affected. So hopefully you can all see the tables there, and I'm going to focus on that blue table. And really that reflects our experience here on our main campus in Orange. And what you can see from our total number of kids that have tested positive, which is 401 on this table from about 2 days ago, the majority of our kids that have tested positive have been in the outpatient setting. So in the emergency room or in the OEC. And that is our outpatient evaluation center, our drive-through tent that was developed by our wonderful Dr. Golden here, who directs our outpatient services. And this has really allowed us to evaluate and treat kids outdoors in a drive-through kind of a manner, and has really facilitated our pre-procedure testing for our kids. So this has been a great boon for us. In general, I think what I'd like to say is that the kids are presenting with typical symptoms when they have them: fever, cough, sore throat, similar to adults. But I will point out that we've noted that about 3/4 of our positive kids have had a positive contact, usually in the household. And so that speaks to what we've suspected, which is that children are not necessarily the primary drivers of transmission in the community the way they are, say, for influenza. It appears that children are more often getting the illness from adult contacts, particularly parents in the household. And then I will point out here our inpatient number, which is up to 50, and that is through this entire time period, not at one time. And things that you can see on this table. One is that there's one cohort that is under the age of 1. And although those young infants have had to be hospitalized, they have done fairly well, I would say. And then the other cohort you can see are the older children from 11 into their mid-20s. And those children, some of them have been quite sick. And we've seen two predominant populations: those children who are immune suppressed, hematology oncology patients, for example. And then we've also noted another cohort, which are our morbidly obese children. And they have really not been handling this virus well. Next slide. Probably everyone heard in the news a little bit about multi-system inflammatory system in children, or MIS-C, as the CDC has named it. And this is a syndrome that was first reported in Europe, mostly in Italy and the UK, and then in some of the really high impacted areas of the Northeast, and finally here in Southern California. And what we're seeing are previously healthy children who seem to have a post-infectious inflammatory syndrome with fevers and inflammation in multiple organs. Some of the children have Kawasaki-like features, and some of them have toxic shock-like features. And I think that we're all learning about this syndrome. It's not common, but certainly some of the children have been ill. And we're learning about the pathophysiology, the best treatment, and what their outcomes are going to be like. I can tell you that here at CHOC, we have had one child who was severely ill, who really fit that description well. We had that child before this syndrome was even described, so kind of diagnosing it in retrospect. And the definition is very non-specific that the CDC has put out. So we have wondered about a few less severely ill children, whether they might have this syndrome, but fortunately have not been as ill. Next slide. So some other considerations that we've really been addressing in pediatrics are some of the mental health issues. So, of course, everyone has been experiencing increased stress due to this pandemic, but of course, our children are not always able to express it as well as adults. So we've really tried to address that and give parents as many resources as possible. I think anybody in the audience today with kids has experienced virtual learning and how difficult that has been for school-age children. And of course, school opening is such a big topic right now, and we are dealing with that in multiple forums. Kids have also been having limitations on their social activities. Their milestones have gone uncelebrated, birthdays, graduations, all of those things that, really make them and their families happy. And we have magnification of pre-existing mental health challenges, particularly in some of our teens, where they may not have their normal pre-existing support system available to them during all of this distancing. So a number of issues, I think, that we have been sensitive to, cognizant of, and trying to address on the pediatric front. Next slide, please. One of the very important issues for us as pediatricians are our routine vaccines. And so what you're seeing here is a graph based on CDC data put out by the MMWR in May. And it shows VFC ordering and how it plummeted in the month of April. In case you're not familiar with it, the VFC program is the Vaccines for Children, which supplies about half of the pediatric immunizations in the country. And you can see a 60% drop in April. And that is very concerning to us as pediatricians, particularly that dotted line with measles containing vaccine, because as I think everyone knows, you need to maintain good herd immunity to prevent measles outbreaks in particular. And as we open up society and global travel, we are really concerned about measles outbreaks. Next slide, please. So in general, we consider routine well child care essential. And our vaccines, as I mentioned, extremely important. We don't want to have vaccine preventable disease outbreaks like measles or pertussis. We're very concerned, as is everyone, about flu and what it could mean if we have convergence of COVID as well as flu, what that would look like. And so here at CHOC, we've been partnering with other organizations and professional societies like the AAP, the California Immunization Coalition, to make sure that children get their well child visits and their routine vaccines. Well child visits are also important for a number of reasons. We find developmental delays, other pathologies, so we consider those essential. And in terms of vaccines, I'll just touch, finally on the COVID vaccine. And, as we work on development and licensure of those vaccines, we also have to think about implementation and distribution and deal with the fact that acceptance is also going to be an issue, particularly in some places like Orange County, where we've had some issues with vaccine hesitancy. So those are just some of the pediatric specific issues I think that we've been trying to address and that have been keeping some of us at CHOC awake at night. And certainly if there are questions, we'll be happy to take those in the chat box and try to address them for you later on. Thank you so much.
Well, thank you so much, Dr. Singh. That was extremely detailed and valuable information. We appreciate very much your service and everything you have to offer. So we're going to now thank you once again. Thank all of our healthcare panelists today. And we are going to take a short commercial break, but we're going to be right back with our next expert panel to discuss public policy and how we meet the needs of our public health and local businesses. We're going to disinfect, put back our masks, and be right back to you. So stay tuned.
What's next? For us, it's not a question, it's a call to action. While a lot has changed, our dedication to a brighter tomorrow is stronger than ever. UCI Health combines life-saving medicine, groundbreaking research, and breakthrough innovation to conquer our community's toughest challenges, so you and your loved ones can embrace the days ahead. What's next is a healthier tomorrow, and we promise to stop at nothing to get us there, together.
I'm spilt milk and a cookie dough thief. I am 3 feet 10, 4 feet 9, and 6 feet 1. I am a first kiss and the last to be picked. I am a monkey, a frog, and an entomologist. I am sticks, stones, and broken hearts. I am not a fan of bedtime or broccoli. I am lost and found. I am a gallant hero recovering from an epic battle. I am childhood.
Thank you.
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 Gracias.
History isn't reserved for black and white photos covered in dust. We have the power to make history with every song recorded, with every hashtag created, with every barrier broken. History is alive, and we make it every day.
We're proud to support our partner Lonnie Bunch III, who brings history to life during Black History Month and every other day of the year. What would you like the power to do?
Welcome back, everyone, to OC Forum's The Future of the COVID Curve, presented by UCI and UCI Health. Again, Lucy Dunn, Orange County Business Council, moderating our second panel of the day. All leaders sitting at the nexus of keeping both our communities and local businesses healthy. And I want to let you know, for purposes of safety, we did clean the dais. Everyone was masked up before we started this panel discussion, and all the appropriate protocols were in place. And the beauty of being at the Cove today is that our guests can be physically distanced by 6 feet, so that just like the news show at night, we get to use their expertise without masks. But we're going to get into that as well. So joining our discussion today, Daniel Parker, Assistant Professor, Epidemiology, UCI Public Health; Georgina Maldonado, Executive Director of the Children's Health Initiative of Orange County; Chris Schwartz, Director of UCI's Center for Investment and Wealth Management. He'll join us in a little bit. But we also have Mike Hill, Director, Cal State Fullerton, SBDC. Wonderful to have you all. So give our viewers a little bit of background on all of you in your respective capacities. You're dedicated to serving groups across the spectrum during this crisis. It's very cool. I would like to start with Daniel. And so for decades, UCI has been a public health leader in Orange County, serving populations that may have not had access to routine medical care. What are we doing in Orange County to help communities that have been most affected by COVID-19? I think Anaheim, Santa Ana, we've got some really difficult communities. Jump in.
Yeah, so I would split this into two different kinds of groups. One, you'd think about this from a geography perspective, and then another would be from more of a demography perspective, right? So there's some certain subsets of all populations that are at more risk of severe disease and even death from COVID-19. But also with geography, we've seen when the epidemic, and this pandemic, it's a series of lots of local epidemics, right? And when our local epidemics started here in Orange County, they started off in the central coastal areas, and they're more affluent communities like Newport Beach and Laguna Beach and those areas, but they quickly shifted up into the northern areas, and now we have big hotspots around Anaheim and Santa Ana. And so from the UCI public health standpoint, what we're doing about this, I could split into three different areas. One is on analytics, another on communication of results, scientific results, and then three is on action. And so from the analytics side, we've been working with the Orange County Healthcare Agency and other community-based organizations like Latino Health Access, Capica, and groups like this, to analyze data to see where, at fine resolution in space and time, where is the burden of this disease, because it moves really fast. And from that, we've got a lot of communication that's going on with this too. The communicating science results is maybe science in the absence of proper communication is almost useless. So this is so important. And so we're communicating these results all over the place. We're speaking with the press, we're giving talks like this one here today. We're going to community meetings. Yesterday I was showing some results to high school students in Anaheim, and also doing lots of social media. Right?
Very good.
Right. Oh, and then action real quick. So we're also training people. We're working right now to train people to be contact tracers so that we can actually get involved. And we're working with community-based organizations and the Orange County Healthcare Agency to do that.
That's great. Daniel, we talked a little bit in the first panel about masks and the importance of masks. We had our healthcare leaders say, number one, way to prevent the disease, right? Why are they so controversial? Can you talk a little bit about that? What do you think's going on here? Especially when we have other countries that have been using them effectively, and they're already reopening, and we're still debating masks.
This is true. So I lived before coming to UCI. I lived in Thailand for 4 years actually, and there was no. This isn't a political debate for people
exactly.
there. When you need to wear a mask, you just wear a mask, right?
Right, right.
I feel like a little bit of the problem has been that there have been debates within the scientific community about how to wear a mask, if people will properly wear a mask, or if they're just going to put them on the ground, or if they're going to stop washing their hands, or engage in risky behavior. And I worry that some of our internal science debates kind of muddied the communication to the public. But it also, a little bit of, as Americans, we kind of like this rugged individualism, right? So we want to be strong. We don't want to wear masks. We don't want to do what people tell us to do. But I think it's really, we've got to get beyond that. It's time to take care of our community members and the most vulnerable in the community.
As a woman of faith, I say, my mask protects you. Your mask protects me, and for my faith, it's part of the golden rule, right? Treat others the way you would be treated, right?
Exactly.
So, and every religion has some form of the golden rule. So, as a person of faith, that was what was driving me. But on top of it, there's now strong evidence that it really is helping stem contagion.
Exactly.
Yeah,
exactly.
Very good. Can you also, there are exceptions to the mask rule. Could you talk a little bit about those exceptions and for folks? So
particularly with regard to people who have some types of disabilities, and I don't want to lump this together because there's wide array of different types of disabilities that could affect this. It could be, for example, that you have asthma or trouble breathing or something like that would make it so you couldn't wear a mask. Or perhaps you have severe anxiety issues, or people on the autism spectrum some people on the autism spectrum may have sensory issues that make it to where they just can't function if they have a mask on.
Right.
So for people like that, they can't wear a mask.
Right.
And so we all have to kind of weigh out our risks as we're living right now. We're going to be living with this for a while, I'm afraid.
That's right.
Today, I'm here. I wore a mask here right before the camera, or right as the camera was coming to me. I took my mask off. I'm taking a calculated risk not to wear a mask right now because I think it's important to get the message out.
Exactly.
We have to do the same thing in these cases. Some people may not be able to wear masks, so you need to make calculated risks about do they need to be out in public as much? If you can't wear a mask, should you be out in public? Sometimes you have to, right? And the second part of this is if everyone else is wearing a mask, there's still some group level protection of those people who can't wear a mask. But still, I think you have to keep in the back of your mind that it is a risk.
Yeah.
So you just have to weigh these.
You have to weigh it.
Yeah.
It's interesting too because I've in talking with Orange County's healthcare officer, Dr. Chow. There's no certificate that you can carry around to identify that you have an exception. There's nothing that's official. And it's a bit of compassion that we have to use as human beings, again, with that kind of golden rule philosophy. Don't you agree?
I completely agree.
Yeah.
And we are living through strange times, right? So, yeah, we just have to, we're going through there will be all sorts of social awkwardness when we see people who aren't wearing masks, people who are doing things we can't believe. We have to really, we just have to weigh our risks and be thinking about our communities. We have to take care of each other.
I have also some businesses that will, you know, the old line, no shirt, no shoes, no service, and now they've added no mask, no service. And that's really to protect their workers. So we should all, again, not be offended if you can't patronize a business.
Absolutely.
And you're not wearing a mask, please come back another day.
Absolutely.
Don't you agree?
I completely agree. It's been really eye-opening to me to see what we consider as a society as essential workers. It's not what I would have envisioned if you'd asked me a year ago, what is an essential worker? I wouldn't have thought about the people who are providing food services or checking out the groceries and these sorts of things. But these are the people we really need to protect them now. They're providing crucial services for us.
Thank you. Thank you very much, Daniel. Mike, I'm turning to you now, Director of the Small Business Development Center. You've certainly been at the center of trying to help people with resources in this economic storm. Can you tell us what you're hearing from the business community and the momentum on the public policy side with assistance programs, loans, grants to help businesses survive in this tough time?
I think I appreciate that. I think it's a really important question. We service Orange County and Inland Empire in our local network. There's 64 networks around the country for the SBDC. And we've helped about 6,000 businesses since March, which is an incredible number when last year, for the whole year, we did 3,000 businesses. So it's been a pretty remarkable inflow. And you spoke to it just a minute ago, there's some confusion. They don't really know when the economy gets shut down, when's it going to reopen? How do I work with my employees? How do I work with my customers? Am I viable? Is customer behavior changing in a way where my customers aren't going to come back the same way that they did before? And so what we're seeing is, it started out, everyone needed some capital because businesses were just shut down. And so they didn't have enough money to really, sustain themselves. So EIDL and PPP, EIDL is the economic injury disaster loan that a lot of businesses got, and then PPP is the Paycheck Protection Program. So a lot of those businesses came to us and we could help them get that initial capital into their businesses. But it's really difficult when you take loans like that to understand, how do I forecast 3 months, 4 months, 6 months? I don't know how. This is brand new. We're very much in uncharted territories. So they take some funding, they get some federal resources, and I got to tell you, it doesn't really matter what side of the political aisle you're on. What has happened with the liquidity has been remarkable. The amount of money that has been made available to businesses. We can all argue it wasn't fast enough, it wasn't slow enough, but money is in the hands of businesses and they're using it effectively to keep their businesses alive for now. So what we saw was a shift. We saw, help me get this EIDL and this PPP money. And then it was, help me understand how to spend this money so that it can be forgiven as a grant, at least some of it can be. Then it was, that money is beginning to run out. My business hasn't opened up yet. My customers aren't back. Now what do I do? And so there's really this, it's ebbing and flowing in a very precarious way right now where there's just a lot of uncertainty. And so navigating those waters, that's really what the SBDC is all about. That's what we're trying to do, is help them determine, are they viable today and will they be viable tomorrow? Has customer behavior changed in such a way that they need to pivot, or what we call reconcept their business? And that's where we're spending a lot of time today.
Do you think these programs are working?
Yeah, for sure.
Yeah.
I mean, what they are doing is they're filling a gap. Now, I'll tell you, when you step back for a moment, it's a finger in a cracked dam.
Exactly.
And we don't know where the next crack is going to come from, but government is responding in a very positive way, and they're doing everything they can, I think, to make sure that resources are available. But at the end of the day, it's that other question. When an entrepreneur starts a business, the first question is, can you be viable? Can you get customers? So the question today is, will you get customers back? Will they come back in a compelling way? And so that's where we're spending our time. And that's really the question that businesses have to answer today.
Oh, very good. Yeah, I think that's the case I'm hearing as well, is that businesses would like to just get back to work as opposed to relying on government funding. However, there are some small businesses that still needed it. They were not able to get any. What advice do we have for them? Do you see more money coming down for them? Is there still money in the system to go after?
There is indeed. And again, such a great question, Lucy. There are a lot of businesses that did receive EIDL and PPP money. But there were a lot that did not. Yeah. And those companies are in danger. They're very much on the precipice and they have to make decisions. There's a lot of family wealth tied up in these businesses. Some of it is multi-generational. Can I keep my business viable? Can I survive without this capital? But there are additional resources. Lots of cities have some CARES money, CARES Act money, and they're putting grant programs together. In fact, in Orange County, we are working with 13 cities right now and deploying additional capital into those businesses, those small companies, so they have some additional working capital. But beyond that, California has state disaster loans that will guarantee up to $50,000 for businesses that don't get EIDL and PPP money. That's one example. If there's a business that's looking to get real estate and they want to move their company into a different area, but they want to buy the land or buy the building, there's 504 loans that are available. There are a ton of resources. The problem is it's not well communicated. We talked about communication before. We've got to do a better job of making sure that businesses know, hey, there's resources out there.
Yeah, terrific. Thank you so much, Mike. And
sure.
We'll be able to get information to folks if they need to reach you for SBDC. Appreciate your work. Georgina, welcome.
Thank you.
As a leader of an organization focused on the grassroots community side, you're enrolling residents into programs like Medi-Cal and other social programs. Can you tell us a little bit about the impacts you're seeing for some of our most vulnerable folks?
Thank you, Lucy, and I appreciate this opportunity. And it's interesting the way we discussed the mask, then we also discussed the business aspect of it, because I feel we as an organization are in the middle of all of this. On the one end, we understand the healthcare impacts, and what we're seeing is an increased number of individuals who are uninsured and or families. And so on the business side of things, we did see a significant influx of uninsured individuals seeking coverage March, April, May. Then with the infusion of the PPP loan and EIDL loan, that tapered off for us as an organization. But then also what we're noticing, and throughout this entire time, is the increase of lack of food security. Therefore, the numbers of CalFresh locally they're surging significantly, and it doesn't seem to be tapering off. Now, June was an interesting month. Again, EIDL, PPP loans. Back to what the gentleman said earlier, is we did see some plateauing of this. However, once those dollars have been expended, then we may see in the next few weeks, I believe that the PPP loan, we have about 24 weeks to expend those dollars, so we may see another surge of unemployment, thus uninsured.
Very good. Thank you. Thank you for that. What are we doing to outreach when you can't be out in the community? How are we getting the word out to our folks?
Well, fortunately, and historically, Community Health Initiative of Orange County, also known as CHIOC, we have a trusted brand in the community. And so there's many different avenues we're using. One of them is phone banks and email blasts. We're also using digital media as it relates to Facebook, Instagram, and I'd like to implement the TikTok because it is important to also reach the younger adult population. But on top of that, we're also reaching to the business organizations such as OCBC, where our link to our website is incorporated into one of your resource lists that is sent to your members every single day. And so that's the business community. Now we talk about other community-based organizations. We do house the Orange County Health Access and Enrollment Task Force, which comprises of 35 health-related organizations all across Orange County, and we're all working together collaboratively to spread the message of the importance of healthcare coverage. It's always been important, but I think now more than ever, we see the disparities, and so it's something that we need to pay attention to.
You know, there's no question that a pandemic really exposes systemic flaws
Absolutely.
like you've never seen before, right?
Right.
And one of the issues that you wanted to highlight in particular were some of those flaws where we're trying to reach people, and yet we also need monolingual, we need interpreters for monolingual populations. Can you talk a little bit about that and what else you're seeing? What are the needs, those flaws?
Well, and you know, it's interesting because as an organization, one of the barriers that we've always had is the language barrier. But what we're seeing is becoming more of a problem is the inconsistent messaging of COVID-19. It goes back to the scientists had a little bit to, they had a discussion about what was happening, masks, no mask, how important are they? So that creates more confusion to our communities who are monolingual Spanish speaking. Also, the testing sites. Are they open? Are they not open? Where is a consistent message? So that creates a barrier on top of individuals who are monolingual, whether it's Spanish speaking or any other threshold language in Orange County that they have.
That's a really good point. I need to get to Chris, but I want Daniel to jump in and Georgina on those tests. That's kind of one of those confusing things. In LA County, they always say, if you want a test, you can get a test. In Orange County, the words are, go to your healthcare provider first to get a test, and if they say no, then the county can get you a test. Am I interpreting that correctly? How does that work? Daniel, you want to jump in?
We're basically failing again.
Okay.
We should have tests.
We should highlight this.
Everybody should have access to a test without cost.
Great.
We don't want any barriers there. We want people who feel sick to get diagnosed so that they know if they need to isolate.
Okay, I'm going to make that on one of my action items as well at OCBC to work on. Anything else on that one, Georgina?
Well, one of the things I do like to add is, again, going back to that confusion where if we do, so for the clients who do have healthcare coverage, and we know we have healthcare coverage because we verify the system. We have access to the system of verification, whether they're on Medi-Cal or Covered California. And what's been happening is, although they have coverage, they're unfortunately still being turned away by their own providers who are promoting in the media. That's one. On the other side of it is, for the individuals who don't have healthcare coverage because of immigration status or they simply aren't interested in having healthcare coverage, what's happening is either they have health centers who are charging $60 or $350. So what's happening is the $60 is reasonable, but then you go to $200 or $350, they have symptoms, but yet they forego obtaining a test because they can't afford it.
Okay, we're going to figure this one out because this is a good to-do list after today's program, right?
Yeah.
Thank you both very much. All right, audience, I have to tell you, in full disclosure, first of all, we've now just been joined by Chris Schwartz, but the dais was cleaned and sanitized. All protocols were observed before he joined our panel, so I want you not to freak out there. We did the right thing to make sure Chris was safe and we're safe. Secondly, full disclosure, I'm a big fangirl of Chris. He doesn't even know this, but if you haven't caught any of his economic forecasts or his presentations, they are some of the most accessible and packed with great information for business folks. Look for them in webinars to come. So with that as full disclosure, so you already know what my bias is here. Chris, sorry. Looking at the big picture, don't be embarrassed. Looking at the big picture, what is your assessment of the countywide impact on coronavirus on businesses today?
Obviously, it's been bad, right? So, if you think about Newport Beach, I was just down there a couple of weeks ago, and usually you can't even get, on Balboa Peninsula or Balboa Island. It takes you forever, and you just sit in traffic, and now you can just, breeze down and get down there in 2 seconds. And so, there's obviously been a huge impact on tourism. That gets to the hotels and the restaurants. And we're not immune. Look at the biggest private employer in the county is Disneyland, right? And they finally reopened downtown Disney yesterday. I'm not sure I would have been one of the people to wait in the long line, given current coronavirus stats, but they were down there. But it's been a huge impact, and it'll continue to be a big impact. And I think right now you see a lot of people pulling back on behavior because of the spike in cases. So if you start to, OpenTable has been really good about publishing daily restaurant data, and you can actually see now the recovery in restaurants has actually started to tail off, even in places where there are no restrictions, as people get more fearful about the virus again.
Yeah. Very good. It's interesting though too. I happened to watch a presentation at Disney on the protocols they're putting in place. They have significant experience now, having opened Shanghai, Hong Kong, Tokyo. Paris is opening, I think, this week or next. And even Disney World, and Florida is one of those tough states with climbing numbers. So it isn't as crowded as those lines might have represented. They really are trying to maintain the best in protocols. And they did delay a 65th anniversary opening on the 17th. Chris, also talk a little bit about the National Jobs Report. It was surprisingly good, actually. What does that tell us, or was it? Give us your perspective on that.
So the good news is the top line number was good. So top line number was, we created a few million jobs. But I think you have to keep things in perspective. Still in 3 months, we've lost almost 11 million jobs. Exactly. The U.S. Census has this great survey, they call it a flash survey, to do every week. And they ask people whether or not they're employed or not that particular week. And actually, in the last 2 weeks, it seems that we've lost about 1.5 million jobs based on that census. I think that can get back to the jump in cases. But if you look deeper at the numbers, I think the biggest concern is the number of permanent jobs lost. It continues to climb, right? So at the beginning, everyone thought they were temporarily unemployed for a couple of weeks and everything was going to go back to normal. And so at this point, it looks like we're not going to go back to normal that quickly. And now these temporary jobs are becoming permanent job losses. And every day you read about another store that's never reopening or another place that's closing 1,000 locations. And so I think, the jobs report was great. It was great we got back, 30 or 25% of the jobs we lost, but we still lost more jobs than we did cumulative in 07, 09. The last big recession, which was the worst since the Great Depression. So I think we'll probably have job losses this month. So I think it's a tough environment still.
Tough environment. And I've heard some folks say, oh, this is going to be a V curve, this is going to be a U curve, this is going to be a W. Yeah. Do you have a sense of what this hockey stick looks like?
Sure. So the great news, if you have kids, you can just have them watch CNBC, because every morning it's brought to you by a different letter of the recovery. But I think the swoosh is probably the most likely recovery point. I think everyone has to remember there's always a stage, right? So the first thing always to recover is the stock market, right? Because it's forward-looking, and then the next thing to recover is typically GDP, and then the last thing always to recover is employment. So companies get more lean and mean. They figure out, we didn't need all those people that did what we did before. In good times, we can squeeze a little bit more out of the people that we have. And so I think it's probably more like a Nike situation. Although I'll have to be honest, I'm very disappointed where we are with the COVID numbers. We probably opened too early. You talk about my webinars on the econ forecast. I pretty much preached in March, April, May that we wouldn't open until after Memorial Day, because why the hell would we let people get together after 3 months of being cooped up inside to have parties? And we opened, and now we're paying the price. And I don't care if you're Republican or a Democrat, or if you want to wear a mask. If you don't want to wear a mask, policymakers like the governor are going to set the policy based on what they think is best. My opinion doesn't matter. And if case numbers go up, they're going to shut us down. And if they shut us down again, now that the Republicans aren't very excited about giving out more money for unemployment and whatnot, the transfer payments go away. We're going to have a huge financial problem with rents and commercial real estate. And as we get closer to November 4th, or what day is the election? November 4th? 3rd? Whatever day it is. 3rd, thank you. It's going to be harder and harder to get stimulus out. So, I'm pretty concerned, to be honest. I was more optimistic a couple months ago. But I'm pretty concerned about case
I think
data.
that's really important. So, particularly with the wealth management aspect of your portfolio that you advise us so well on, what advice do you have for businesses out there right now?
It probably really depends on what business you're in. I think PPP was great. I think the extension they did to give 24 weeks, I think, is good for. To be frank, I think it's good for the businesses, probably bad for the employees, right? Because now it used to be the money had to use for payroll, but now you can extend the payroll, right? And you can lay people off and use the money for rent or something else. So that's good for the business. I think for the business, I think unfortunately you still have to be very cautious, right? You're not going to get you got to hoard cash right now. If you're an airline, how do you run on 20% capacity, right? If you're a restaurant, how do you run your business on 60% or 70% or whatever, down sales, to 30% capacity. I mean, no business is set up to run at those kind of utilization numbers. And so unfortunately, one of the blogs I follow, calculatoristblog.com, Bill McBride says the virus is in control, right? And it honestly doesn't matter if we shut down or not. If people are scared, they're not going to do stuff.
That's a good point. Can you talk about consumers and where the consumer numbers are? That drives a lot of our economy, right? So if they're not going to come and visit our businesses because they don't perceive them to be safe.
That's right.
A little bit?
Yeah, so I mean, I think that's the big issue. So there's a lot of work done. If you take Sweden, for example, right? So Sweden's had this model, which is kind of the model we have now, which is just, I'm going to call it, for lack of a better phrase, the screw it model, which is, people are going to die, but that is what it is. And then you compare that to Finland or Norway. Their economy suffered almost as much as Finland and Norway, who actually did the lockdown because people in Sweden got scared and stopped going to restaurants and stopped, going out. And so, we have the same kind of thing here. Now, the interesting part is if you actually look, because of all the transfer payments from the government, people actually their incomes, they actually have more money to spend now than they did before, and they have less places to spend it. And so you're actually seeing, it's funny you have this dichotomy for, if you look at, I think the savings rate went up 33%, and deposits at banks went up $2 trillion in the last 2 months. And you start to see inflation in things because people can only spend their money so many places. So if you look at food at grocery stores, if you look at puzzles online at Amazon, if you look at even Apple is going to raise the iPhone cost $50 this year, it looks like, or $100. So I think you're going to have this very strange dichotomy where people have money to spend. They're not going to do it at places they don't feel safe. But on things they feel safe for, we'll probably see some inflation as people hoard their money and spend it there.
Very good. Thank you, Chris. Thank you.
Sure.
We're almost out of time. This panel goes so fast because we've got a half an hour, but I want to give Georgina and Daniel the last words here. Give us a sentence or so from your perspective, what do our viewers need to do to stay ahead of the COVID curve? What do they need to do, Georgina?
Wear your mask.
Thank you.
Listen to your public health officials. Enroll into healthcare coverage. I cannot stress that enough, whether it's COBRA, Covered California, or Medi-Cal, please obtain your healthcare coverage. And that's really it.
Good.
Yeah.
Good advice. Thank you, Daniel.
So I'll say again, wear your mask. Also, wash your hands. And if you don't need to be out in public and around people, then don't. And prepare yourselves, because I believe we're going to be dealing with this for some time into the future. So prepare.
I agree. Yeah, I mean, we know our restaurants are shut down now because of our, increased infection rate. Poor guys, I mean, they're living on an edge anyway, right? And so getting those guys to come back safely, I don't know that we want another shutdown of business. That's our job, is stay open now that we're open, and stay open healthfully. Well, I thank you all very, very much for your great insights, and I hope our audience also appreciated that. I want to take this opportunity as well, before we close out, to give a little bit of little good advice for you. So if you've got those cell phones, if you've got your phones out, take a quick look at some of these slides that I'd like to present to you. This is a very short version of a webinar that Dr. Clayton Chow of the Orange County Healthcare Agency and I do on how to reopen safely for your business. This is an order, so I need you to take a picture of this. Here's a good summary slide of the 3 steps. There's only 3 steps on how to reopen your businesses, and it doesn't matter whether you're open now or not open now. Prepare, if you're not open, to do these 3 steps. If you are open, do this. You need to give your workers confidence, and you need to give your customers confidence. So the 3 steps are simply: go to this website, take a photo of this one, find your industry-specific guidance. With that guidance, there will be a check sheet, a checklist of things to do. Read it, follow the checklist, post the checklist in a public place, and then post an attestation saying you did that. Let me show you what those look like. So in retail, here's what the checklist looks like. In restaurants, here's what it looks like. Don't freak out. business owners. You're doing this stuff anyway, but these are the things, 3 pages for restaurants that you need to post in a public place. If you're an office, here's what the checklist looks like. Some of the guidance for your industry sectors don't have checklists, don't worry about. Here's what an attestation looks like. Take a photograph of this slide and just copy it, complete it, saying that you've done the job. This is the attestation you need. So in summary, really, 3 steps. Find your guidance, find your checklist, and post it after completing the steps. Get that attestation and post it. And a little bit of advanced news, I believe the county is looking at rewarding restaurants with funding for PPE if they do these compliance steps and then let us know. So that's it in a nutshell on our little summary here. Whoops, I think we're done on that one. So my little commercial for OCBC and to get you to stay open now that you're open and reopen safely. All right, so with that, thank you all so much for joining us today. We just packed this thing full of information that I hope that you can use. Thank you again to our panelists that were joining us today. Really appreciate all of you. And thank you, our viewers. We hope you found this program helpful and informative. Our sponsors are terrific as always, UCI and UCI Health, for making this virtual program possible. Thank you so much. For more information and resources, you can visit the UCI, OC Forum, or even OCBC's websites, where you can find links to a wide variety of community resources. Those links are in the description section for this program. Again, thank you for joining us today. Get those masks on. Mask up, everybody, and we hope you and your loved ones stay safe and ahead of the curve.